Welcome back, students. This week we will be covering chapters 4 and 5. Chapter 4 is all about anatomical terminology. So you're going to want to be able to visualize patients in the anatomical position, identify the planes and sections of the body, use correct directional terms, use anatomical terms to refer to body surface structures, place internal organs in the correct body cavity, and use either anatomical divisions or clinical divisions to describe the abdominopelvic cavity. These are the anatomical combining forms that you're going to need to know for Chapter 4. Abdominal refers to the abdomen, antero refers to the front side of the body, brachio to the arm, caudo, tail, cephallo, head, cervico, neck, chondro, cartilage, cranio, skull, cubito, elbow. Disto means away from the beginning of the structure. Dorso means the back side of the body. Femoro refers to the femur or also the thigh bone. Gastro, stomach. Genito refers to genitals. Gluteo, buttocks. Ilio refers to ilium, which is a part of the pelvis. Infero refers to below, and inguino refers to the groin. Latero refers to the side, lumbo, lower back, medio, middle, naso, nose, oro, mouth. Orbito means the eye socket, otto, ear, patello refers to the patella, which is the kneecap, pelvo, the pelvis, postero is the back side of the body, proximo means near to the beginning of a structure, scapulo is the scapula or the shoulder blade, spino means spine. Sterno refers to the sternum or the breastbone. Supero is above. Thoraco is chest. Ventro is the belly side of the body. And vertebra refers to the vertebra or the backbone. Let's review some suffixes as well because you're going to need these suffixes to create anatomical terms. So all of these suffixes mean pertaining to: ac, al, ar, iac, ic, and ear. And there are going to be a few prefixes that are also going to help you when you're creating anatomical terms. Ante means before or in front of. Epi means above. Hypo means below or insufficient. And retro means behind. Health professionals visualize patients in the anatomical position. So this man standing here is in the anatomical position. He's standing upright, his legs are together, and his feet are forward. Arms are at the sides, palms forward, fingers extended, and the eyes are straight ahead. And basically what this position is used for is for providing a standard frame of reference. The human body is three-dimensional, but it's going to be divided into three different planes. So you'll have a frontal, also called a coronal plane, the sagittal plane, and the transverse plane. So images of the body are going to be two-dimensional, and they're going to be taken along one of the planes to give a section. Cross-sectional views of organs are an example of a plane that produces a section. The frontal or coronal plane is a vertical plane that runs from side to side. It's going to slice the body into an anterior and a posterior portion, and it's going to cut along the frontal plane, producing a frontal or coronal section. The sagittal plane is also a vertical plane, but this one runs from front to back. It's going to slice the body into left and right portions, and a cut from a sagittal plane is going to produce a sagittal section. A line down the center of the body dividing it into equal left and right halves is called a mid-sagittal line. The only horizontal plane is the transverse plane, and it slices the body into upper and lower portions. A cut along the transverse plane produces a transverse section. A longitudinal section is produced by a lengthwise slice along the axis of a structure. A cut down the length of an arm produces a longitudinal section of the arm. A cross-section is produced by a slice perpendicular to the long axis of a structure. So a cut down across the upper arm produces a cross-section of the arm. Go to page 34 in chapter 4 and look at figure 4.4. This shows you a longitudinal and a cross section of a banana, and that really helps you to understand the difference between the two. Directional terminology always indicates the position of a structure in relation to another structure. For example, consider the position of the heart in relation to the stomach. So the heart is superior to the stomach. However, the stomach is inferior to the heart. And what you'll note is that directional terms always come in opposite pairs. So if you look at the figure on the right, you'll see that distal is the opposite to proximal, and right is the opposite to left. Medial is the opposite to lateral. Posterior opposes anterior, and also dorsal is the opposite to ventral. And then superior is the opposite to inferior, and cephalic would be the opposite of caudal. Okay, so pause the video, and I want you to go to page 36 and 37 and complete the activity called Building Directional Terms. When you've completed that, you can come back and continue playing the video and see if you got all the answers correct. So that was a pretty basic activity, and you could pretty much get the right answer just by looking at it. But just in case, let's review. Superior means pertaining to the front side of the body. Caudal means pertaining to the tail. Cephalic means pertaining to the head. Distal means pertaining to away from the beginning of a structure. Dorsal means pertaining to the back side of the body. Inferior pertaining to below. And lateral pertaining to the side. Medial means pertaining to the middle. Posterior pertaining to the back side of the body. Proximal pertaining to near to the beginning of the structure. Superior pertaining to above. And ventral pertaining to the belly side of the body. You are also given some directional terms that are not built from word parts. So deep means further below from the surface. Superficial means nearer to the surface. Prone means to lie face down, and supine means to lie face up. This figure shows the anterior and posterior views of the body and the various regions of the body. So the anterior view is on the left and the posterior view is on the right. So let's start superior and go inferior, beginning with cranial, which refers to the skull, orbital, which refers to the eye socket, nasal, nose, otic, ear, oral, mouth. Cervical refers to the neck. Thoracic, chest, sternum, or sternal refers to the breastbone region. Axillary refers to the region in the armpit. Brachial refers to the arm region. Antecubital refers to the region on the other side of the elbow. Abdominal refers to the abdominal region. Umbilical, the region around the belly button. Pelvic refers to the pelvic region or pelvis region. Inguinal to the groin region, and genital refers to the region surrounding the genitals. Palmar refers to the palm of the hand. Femoral refers to the region surrounding the thigh. Patellar refers to the region surrounding the front of the knee. And then plantar refers to the region at the bottom of the foot. So moving over to the image on the right, this is the posterior view, and we see vertebral, which is referring to the vertebra or the spine region. Scapular refers to the scapular region. We see gluteal, which refers to the buttocks, and popliteal refers to the back side of the knee. A couple other ideas you need to know are the trunk, which is pretty obvious right there what that refers to. When we talk about the upper extremities, we're talking about the arms, and we talk about the lower extremities, we're talking about the legs. So these words should be a review of what we saw in the previous figure. I will go through and read off each word so that you can pronounce them, and you should try and fill in the table on page 39 and 40. Abdominal, brachial, cervical, cranial, cubital, femoral, genital, gluteal, and inguinal. nasal, orbital, oral, otic, patellar, pelvic, scapular, sternal, thoracic, and vertebral. And these are some body surface terms that aren't built from word parts. Axillary is the underarm area. Palmar refers to the palm of the hand. Lower extremity refers to the entire leg. Upper extremity refers to the entire arm. Plantar refers to the sole of the foot. Popliteal refers to the back of the knee. Trunk refers to the torso. And umbilical refers to the navel or the belly button area. Most of our internal organs are going to be found within one of four body cavities. So we're going to have two cavities that lie dorsal, which means they're going to be on the back side of the body. And they're called the cranial cavity and the spinal cavity. And then you're going to have two cavities that are ventral. That means they're going to be on the front side of the body. And those are going to be the thoracic cavity and the abdominal pelvic cavity. And most organs are inside protective sacs within these cavities. So when I refer to the back side of the body, I am going to refer to the dorsal region from now on. And when I refer to the front side of the body, I'm going to be referring to the ventral region from now on. If you look at the figure on the left, you will see a lateral view where the cranial cavity and the spinal cavity are on the dorsal side of that body, and the thoracic cavity and the abdominal pelvic cavity are on the ventral side of the body. And then if we look at the anterior view, we can see the thoracic cavity and the abdominal pelvic cavity on the ventral side. And then if you look up or superior from these, you can see the cranial cavity and the spinal cavity, which would be located on the dorsal region. Within the cranial and spinal cavity, you're going to have a protective sac called the meninges. And the meninges are what's going to surround the brain and the spinal cord to help protect those. And then surrounding the heart is the pericardial sac. And then next is the pleura, which surrounds the lungs. And then finally, there is the peritoneum. And the peritoneum is going to house most of the organs in the abdominal pelvic cavity. The major abdominal pelvic organ that lies outside the peritoneum are the kidneys. And these organs are located on either side of the vertebral column just under the lower ribs. Because they are behind the peritoneum, their position is called retroperitoneal. Due to its size, the abdominal pelvic cavity can be broken down into smaller descriptive pieces. There's going to be two different methods for dividing this cavity. The clinical divisions break the cavity into four parts, and the parts are equal in size. The names of the parts are based on location: the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. The anatomical divisions break the cavity into 9 parts, and those divisions resemble a tic-tac-toe board. The names are positional, and they're constructed based on anatomical terms. So I want you to look at those anatomical terms in your book on page 43, and I will read them to you. Right hypochondriac region, right lumbar region, right iliac or inguinal region, epigastric region, umbilical region, hypogastric region, left hypochondriac region, left lumbar region, and left iliac or inguinal region. So that's the end of chapter 4. Let me encourage you to do the practice and review on pages 44, 45, 46, and 47. I won't be checking that as homework, but it's really going to help you learn the material for the quiz. Chapter 5 is all about dermatology and the integumentary system. Here are our learning objectives. You're going to need to be able to describe the specialty of dermatology, understand the function of the skin, define dermatology and related combining forms, prefixes, and suffixes, identify the structures related to dermatology, build dermatology medical terms from word parts, explain dermatology medical terms, and use dermatology abbreviations. The integumentary system includes the skin, hair, and nails. And the skin, or the integument, is the largest organ in the body. It provides protection for the body and aids in temperature regulation, sensation, and waste disposal. So, how does the integumentary system perform its function? First, with protection, the skin is a two-way barrier that keeps pathogens out and vital substances in. For temperature regulation, if the body's too hot, evaporation of sweat and dilation of blood vessels in the skin help to cool the body, while if it's too cold, the blood vessels constrict, and these will help to conserve heat. The skin's fatty subcutaneous layer also helps to act as insulation. As for sensation, the skin contains sensory receptors that send information about touch, pressure, temperature, and pain to the brain. And we're going to learn more about this when we learn about the nervous system. And then waste disposal. You probably didn't even think about this when it came to the skin, but small amounts of waste products, such as excess salt, are going to be excreted from the body in sweat. You're going to need to know the following dermatology combining forms. So I would suggest that you use some of these to make note cards on Quizlet. Adeno refers to gland, adipo refers to fat, cutaneo skin, dermo skin, and dermato also refers to skin. Hydro refers to sweat, kerato refers to keratin or hard or horn-like substance, lipo refers to fat, melano refers to melanin or black, onycho refers to nail, pio refers to pus, sebo refers to sebum or oil, tricho refers to hair, and unguo refers to nail. The following list presents combining forms that aren't specific to the skin but are used for building and defining dermatology terms. Bio refers to life, carcino, cancer, chemo, chemical, cryo, cold, erythro, red, ichthyo, scaly, leuco, white, myco, fungus, necro, death, pediculo, lice, sclero, hardening, vesico, bladder or a sac, xantho, yellow, and zero, dry. Let's review these suffixes that were introduced to us in Chapter 2 because they're used to help build dermatology terms. Al means pertaining to, cool, small, site, cell. Derma, skin condition, ectomy, surgical removal. Genic, producing. Ia, condition. Iasis, abnormal condition. Ic, pertaining to. Itis, inflammation. Logist, one who studies. Logi, study of. Malacia, abnormal softening. Megaly, enlarge, and oid, resembling. Oma is a tumor or mass. Opsy is view of. Os, pertaining to. Osis, an abnormal condition. Os, pertaining to. Pathy, disease. Phasia means eating or swallowing. Plasty, surgical repair. Rhea, discharge. Sclerosis, hardening. Tick, pertaining to. Tome, instrument used to cut. Okay, and let's review these suffixes that were introduced in Chapter 3 because we're going to use them to build dermatology terms as well. And means without, epi, above, hyper, excessive, hypo, below, or insufficient. Intra means within, pachy, thick, per, through, sub means under, and trans, across. All right, let's now work together on building dermatology terms. Open up your book to page 51 as we work through the dermatology terms building on the following screens. We'll work through a sampling of terms, and word parts are going to be divided with slashes in the book. Adeno is a combining form that means gland. You're going to need to build a term that means inflammation of a gland, and you'll notice in the book that they tell you what parts of the word you need. You have the root word, now you need a suffix that means inflammation. Adenitis. A tumor in a gland. You have the root word, now you need a suffix that means tumor. Adenoma. Enlarged gland. You have the root word and the combining vowel, now you need a suffix that means enlarged. adenomegaly. You see how you do that? On the next page, adipo is a combining form that means fat. We're going to build a term that means pertaining to fat. So you take the root word and add a suffix to it. Adipose. We're going to create a word that means fat cell. Adipocyte. And a word that means tumor made of fat. Adipoma. How did you do? I might be going too fast, so please pause the slide, fill in the answers on your own, and then see how you did. So cutaneo is a combining form that means skin. I want you to build a term meaning pertaining to below the skin. Subcutaneous. Pertaining to through the skin. Percutaneous. All right, for derma, which is a suffix that means skin condition, there's 8 different terms you need to build, and I'm only going to give you the answer to a few of them. So pause here, fill in your answers, and then see how you did. Build a term meaning dry skin condition, xeroderma, red skin condition, erythroderma, white skin condition, leukoderma. Are you getting the hang of it? Dermo is a combining form that means skin. Build a term meaning pertaining to over the skin. Epidermal. Pertaining to under the skin. Hypodermic. Pertaining to across the skin. Transdermal. Now that you're getting the hang of this, we're going to speed up a little. And remember, you should pause, fill in the answers yourself, and then check and see if you got them correct. And rewind anytime you need to. Dermato is another combining form that means skin. Dermatology is the study of the skin. Surgical repair of the skin would be dermatoplasty, and hardened skin condition would be dermatosclerosis. Hydro is a combining form that means sweat. Sweat gland inflammation would be hidradenitis. An abnormal condition of excessive sweating would be hyperhidrosis. Kerato or kerato is a combining form that means keratin. If you're going to build a term that means horn-like skin condition, that would be keratoderma. Horn-like abnormal condition would be keratosis. And something that is producing keratin is keratogenic. Lipo is a combining form that means fat. To build a term that means surgical removal of fat, you would say lipectomy. Resembling fat would be lipoid. Melano is a combining form that means melanin. So building a term that means a black tumor would be melanoma. A black cell would be a melanocyte. And pertaining to being black would be melanotic. Onycho is a combining form that means nail. Inflammation of a nail, onychitis. Abnormal softening of a nail, onychomalacia. Condition of excessive nail growth, hyperonychia. Pyo is a combining form that means pus. Producing pus would be pyogenic. Discharge of pus would be pyuria. Sebo is a combining form that means oil. A term meaning discharge of oil would be seborrhea. Tricho is a combining form that means hair. The term hair eating or chewing or biting would be trichophagia. Ungual is a combining form that means nail. The term ungual means pertaining to a nail. Pertaining to under a nail would be subungual. For this next section, these words include eponyms, modern English words, and those that contain Latin or Greek word parts but are not constructed solely from these parts. When you recognize word parts within a term, they will give you a hint about the word's meaning. In these instances, look for the word parts to follow the terms. So, the term abrasion means a skin injury that scrapes away the surface of the skin. Abscess is a collection of pus in the skin. Alopecia is the absence or loss of hair, especially from the head. Basal cell carcinoma, abbreviated BCC, is a skin cancer in the basal cell layer of the epidermis, a very common cancer that rarely metastasizes or spreads. A biopsy is abbreviated in medical terminology as BX, and that's a surgical removal to take a piece of tissue by a needle, knife, punch, or brush to examine it under a microscope. And a boil is a bacterial infection of a hair follicle. Burns can be first, second, or third degree. Let me show you the difference between them. First degree burn is a mild burn that damages only the epidermis. It can result in erythema, which is a reddening of the skin, but no blisters, and usually there will be no scarring. A second degree burn is going to extend through the epidermis and into the next layer called the dermis. And this is going to cause blisters to form and scarring could occur. And then finally, a third degree burn causes damage to the full thickness of the skin and also the underlying tissues. Infection and fluid loss are usually major concerns because it breaks through the skin, and it usually requires skin grafts to cover the burned areas, and scarring definitely will occur. Cauterization is the intentional destruction of tissue by caustic chemical, electrical current, laser, or freezing. Cellulitis is the inflammation of connective tissue cells of the skin. Chemoabrasion is the removal of superficial layers of the skin using chemicals. This is also called a chemical peel. A contusion would be a blunt trauma to the skin that results in bruising, but no break in the skin. Cryosurgery is using extreme cold to freeze and destroy tissue. And culture and sensitivity, also abbreviated CNS, is a laboratory test that grows a colony of bacteria removed from the infected area in order to identify the specific type of bacteria and its sensitivity to a variety of antibiotics. A cyst is a fluid-filled sac under the skin. Debridement would be the removal of foreign material and a dead or damaged tissue from a wound. Decubitus ulcer is also called a decube, and this would be an open sore caused by pressure over a bony prominence obstructing blood flow. So it might be hard to understand, but basically these can appear in bedridden patients who lie in one position for too long, and these can be difficult to heal. So if they're lying too long on their hips or something like that, they're commonly called a bed sore or a pressure sore, if that helps you understand a little more. A dermabrasion is the scraping of the skin with a rotary wire brushes or sandpaper, and these are used to remove acne scars. A dermatome is an instrument that cuts out small sections of skin to be used for a graft. This picture here shows an ecchymosis, which is a black and blue skin bruise caused by blood collection under the skin after a trauma. Erythema is the redness of the skin. Fissure is a crack-like break in the skin. And gangrene is tissue necrosis caused by a loss of blood supply. Herpes simplex is an infection that's caused by the herpes simplex virus, and this causes painful blisters around the lips and nose. You can see those there on the left. They're commonly called fever blisters. The herpes zoster picture that you see here on the left is commonly called shingles, and this is a viral infection of the nerve root, causing an appearance of a very painful blisters along the nerve path. And you can get this if you've ever gotten chickenpox and then you have a reoccurrence. It doesn't look very comfortable. Impetigo is an inflammatory skin disease with pustules that rupture and become crusted. And then a laceration is a jagged edged skin wound caused by the tearing of a skin. But it's not something that actually means that a skin was cut. Laser surgery is the removal of skin lesions and birthmarks using a laser beam. A lesion is basically a general term that indicates the presence of some type of tissue abnormality, wound, or injury. A macule is a flat, discolored spot on the skin surface. An example would be a freckle or a birthmark. Malignant melanoma, abbreviated MM, is an aggressive form of skin cancer that originates in a melanocyte. A melanocyte is a type of skin cell that is pigmented. And this is going to be prone to metastasize or spread. And then necrosis, as you see here on the left, is an area of tissue death. Nevus, pigmented congenital skin blemish, birthmark, or a mole. A nodule would be a solid raised clump of skin cells. Onychia would be a term to indicate inflamed nail bed. A papule is a small solid raised lesion on the surface of the skin. Petechiae are flat, pinpoint purplish spots from bleeding under the skin, and pruritus would mean severe itching. Psoriasis, as you see here on the left, is a chronic inflammatory condition consisting of crusty papules forming patches with circular borders. The term purpura refers to purplish red bruises usually occurring in people with fragile skin. A pustule is a raised spot on the skin containing pus. And a skin graft, abbreviated SG, is the transfer of skin from a normal area to cover another site. And this is used to treat burn victims and after some other surgical procedures. Squamous cell carcinoma can be abbreviated SCC. And this is a type of skin cancer that begins in the epidermis, which is the outer layer of the skin, but this can grow into deeper tissue. In general, it doesn't metastasize to other areas of the body. And I've used this term metastasize a few times. That term means spreading. Tinea is a fungal infection, and that results in itching and scaly lesions. And you can see this picture on the left of this athlete's foot, which is a type of fungal infection. An ulcer is an open sore or lesion in the skin or in the mucous membrane. And urticaria is a skin eruption of pale reddish wheals with severe itching. This is usually associated with food allergies, stress, or a drug reaction. You might know it as the term hives. Varicella, as you see here on the left, is a highly contagious viral infection that causes a skin rash. This is commonly called chickenpox. And you'll notice I talked about a different virus earlier called herpes zoster that leads to shingles. So that same virus causes varicella or chickenpox in usually childhood, and then the second round leads to shingles, which is why it's a really good idea to get vaccinated against chickenpox, because if you never get chickenpox, you're never going to get shingles. The next one is vesicle. And a vesicle is a small fluid-filled raised spot on the skin. Wheal is a small round raised area on the skin that can be accompanied by itching. And this is usually seen in allergic reactions. Here are some common dermatology abbreviations. We've seen some of these before, some we haven't seen. So BCC refers to basal cell carcinoma. BX stands for biopsy. CNS is culture and sensitivity test. D cube would be a decubitus ulcer. Derm stands for dermatology. HSV, herpes simplex virus. IND would be an incision and drainage procedure. ID would mean intradermal. MM would mean malignant melanoma. SCC refers to squamous cell carcinoma. SG refers to a skin graft. STSG refers to split thickness skin graft. And sub C or sub Q means subcutaneous or just below the skin. UNG refers to the term ointment.